Okay, hi everyone. Thank you so much for coming to our session today. Thank you all for waiting, and I hope the music was nice. so so my name is Daniel, and today I'll just be introducing the PEG info session by the 27th com. Yeah. So in terms of the event timeline, I'm just gonna do like a short introduction at the start, just to kind of go through all the details of the PEG that can be found on the website. We will then go on to like a panelist session where we will have four of our PEG members just kind of talk about the PEG process, more so about the application, as well as just other little details that are not found on the website. We will then go on to a Q&A session where you guys can use the live Slido link to just ask your questions, and then we'll finally end off with like closing and announcements. Okay, so I think just some pointers before like we all start. So in terms of questions, please refrain from using the Zoom chat to ask questions. So we're only going to answer the question if you use the Slido link, which we'll post in the Zoom chat, as well as have a QR code later on. So just take note for that. Also do note that during the seminar session, we will allow for some questions to be answered from the Slido link, but do not worry if your questions like suddenly disappear or they're not answered, because we are like actively trying to sort out through the Slido questions so that the process is more smooth, and hopefully we can answer your unanswered questions at the end of the session during the main Q&A. Yeah. Also do note that for this session it will be uploaded to YouTube, so the whole session will be recorded as well. Yeah. Okay. So here are our panelists. So I'm just going to ask them to basically just introduce themselves. If they want to share their screen, just say hi to everyone.
Hi, I'm Elizabeth. I'm currently working as an MO as a year 1 resident in internal medicine in NUH.
Hi everyone, I'm Sean. So I'm a 4th year. I'm going to 5th year in the next academic year.
Hi, I'm Dawn. I'm a 4th year going to 5th year, and I'm from Newcastle Uni.
Hi everyone, I'm Denise. I'm a 5th year going on to 6th year from Edinburgh.
Okay, cool, nice. All right. So thank you everyone for coming and making your time. So for now, I'm just gonna have like a quick introduction on what the PEG is, and it shouldn't take more than like 5 to 10 minutes. So the PEG was first launched by MOH in 2010 as like a financial incentive to basically attract Singaporeans to come like back home to work in the Singaporean healthcare system. So just some like pointers to take note. Only Singaporean citizens can apply. So if you're PR, then it's unfortunate. And there's also no dental scheme. So a lot of people have asked in the past whether or not PEG has a dental scheme, but there is no dental scheme. It was cancelled, I think, a few years back. Yeah, so this is only applicable to medical students. So the applicants must be also from an overseas medical school that is recognized by the SMC. And in terms of who the applicants are, usually they are in their clinical years. So it'll be like, whether be it a 4th, 5th, or 6th year program, it would usually be in the clinical years when you apply. Yeah. So some benefits of the PEG. The most important obviously is the tuition subsidy, where you can get like a 60% tuition fee subsidy capped at 50,000 per year, up to a maximum of 150,000. So the subsidy just depends on the amount that you have to pay. So it's not necessarily you get 50,000 or you get a max of 150,000. It just depends on like it's just a subsidy, so it just helps to like reduce the cost of your school fees. But the good thing as well is that it provides like discounts of flights, so it can help to pay for airfares when you're returning to do medical electives. And yeah, so simply it just helps to defray costs. So obviously there is a bond period, and selection is obviously based on merit and not based on financial situation. So what that means is that they don't look at your financial background and they don't take that into consideration. So it just depends on merit and most likely your clinical grades, as well as how well you have done within the interview. Those who receive a 1-year grant will have to serve for 3 years, and those, sorry, let me just, and those who receive a 2-year and 3-year grant will serve for 4 years. Yeah. So the service bond also includes a 1-year PG, a 1-year houseman year, which can be served locally. So that is inclusive of like the years that you have to serve. So again, about the selection pool, a lot of every year people basically ask, like how does MOHH kind of select? So I think this is from the website. It says that it's a discretionary recruitment scheme, which means that it really just depends on how many people they want each year. And so like it depends on national needs. And I think there's no fixed number. And although there's like a lot of hearsay about like decreasing numbers and all that, I don't think like SMS UK can't confirm that. So we just have to like rely on how many people are accepted per year. Yeah. Okay, so in terms of the application and interview period, all the information that I've just mentioned can be found on the website, and quite importantly, all the requirements. So it's like all the passport, for example, or guarantors that you need can be found on the website. It's just that now the interesting thing is that the period for application has somewhat changed. So usually it will fall around the June-July period in previous years, and usually interviews are in September. But because of like the COVID-19 situation, the period kind of got shifted forward. So now the period falls, the application period kind of falls between the September-October period, which was the case in 2020. Yeah, and then the interviews only occurred in Feb to May of 2021. So I think currently the website has like no future information about the next batch of applications. So I think we can just wait and see. But I would think that because based off like last year's like timeline, it should potentially occur around September, October, and then have interviews in Feb and May, Feb to May, if like the trend follows. Yeah. Okay, thank you so much. That was a quick like introductory segment from me. So I think now we will move on to our seminar session, where we will basically have our wonderful speakers come up. So how it goes is that I will basically ask some questions, and then I will let the speakers answer. So also do note that for those that just joined us, we will only answer questions based off the Slido link. So please do not like post any questions in the Zoom chat. Yeah, so completely use the Slido link, which is now found on the screen. So you can scan the QR code, or you can press on, I don't think you can press on the link, but the link will be posted in the Zoom chat soon. Okay. Zen, can you help spotlight the speakers?
Yeah, it's done.
Okay, cool. All right. So just to kick off, we'll have the first question, which is, why do you think you are a successful PG applicant? And I will ask Sean to answer this question.
Okay, for me, I think it generally boils down to two things. So they didn't actually state what they were looking for, but during the application process, you needed to submit your CV, and after the CV, they would give you an interview. So I think that a well-balanced CV is important. Like it's important to do generally well in your academics, take part in co-curricular activities, and like when you're here back over the summer, maybe you guys can consider to take part in electives or any like work placements. But most importantly, I would say is actually the interview and how you actually do well in it. Because at the end of the day, even with the CV, everybody still gets an interview slot. And they only give me a question regarding a CV. I mean, some people did not even get a question straight regarding a CV. It was straight on to the case report. So for me, they just asked about my COVID-related work that I did over the summer last year. So that was just very short. And then afterwards, it was straight on to the interview. So it's very important to like prepare well for the interview.
Okay, thank you. So does anyone else kind of want to add why they felt that they were a successful PG applicant? Denise, would you like to go?
I think like what Sean said, the interview is the most important. So making sure that you look through the core modules like cardio, respi, GI, and making sure that you got a handle on how to approach certain common clinical scenarios and how to manage them is key to dealing with the interview. They didn't ask me anything about my CV or any of the electives that I've done, so I don't think it's that important.
Okay, cool. Thank you. So I'll just move on to the next question. So for those that have like spent time in Singapore doing electives, do you think that it helped in like securing the PEG? I guess like during the interview, did they kind of ask about it? Dawn, would you like to try or?
So I didn't do any elective because my electives are in fourth year. I did the interview before that. But what I did was like Sean said, like you do work experience, like summer internships or like projects. Yeah. But I think at the end of the day, it's not really about like collecting the elective points or like experience points. I think it's about showing that you're proactive in doing stuff with your summer break. And they want to see that like you are actively pursuing like improving yourself lah. I think so.
Okay. So do you think there were like any qualities or like items within your CV? Okay, sorry, we have a follow-up question actually about electives. So what someone asked, so how does one obtain electives or placements in Singapore during summer? And I guess who to contact and like what's the timeline like? I guess just for, yeah. Does anyone know?
I understand. Oh, sorry.
Go on, Sean.
Okay. I understand that there's actually an NUS portal that you can use to apply, but I've done elective before and I actually didn't use that system. So I actually kind of bypassed the whole thing because usually that takes quite a while. And what I did is that I actually cold email a few professors or doctors that I'm interested in. And then usually they reply to me much faster. And then so the application process is streamlined earlier. Then so the previous one I did was actually with SGH. I did a cardiothoracic surgery placement. So I met a professor and then they sent me the SGH elective form. And then through that, I managed to get a slot pretty fast.
Okay, cool. Thank you. Actually, Denise, would you like to kind of answer the question about electives, whether or not you felt that helped in the interview?
Okay. Actually, I did some electives during my preclinical years at a GP clinic and also some private hospitals. So like what Sean said, I emailed the doctors and professors directly just to streamline the whole process. But during the interview, I don't remember them asking me anything about my electives. They actually told me to come back to Singapore for electives if COVID permits in my final year. So I'm not sure whether it actually played a part in getting the PEG grant.
Okay, thank you. Yeah, I'll just move on to the next question, which is do you think there were any qualities or like items in your CV that I guess made you a better candidate or more competitive? Although you guys did mention that you felt that it was more about the interview.
So I think like in general, I mean things that like can make you stand out is like research, teaching or like volunteering. So for myself, research wise, I did a job as a research coordinator before uni. And then I did an internship in A-Star during my second year summer. And then during fourth year, I worked on like research. And then like it's all about like using your experiences to like expand. So like you can sign up for like presentations at conferences and things like that. And it will really like boost your CV lah in terms of like showing that yeah, you're always trying to improve yourself as a professional. And then volunteering wise, there's always a lot of ways to volunteer. In UK, there's a lot of like soup kitchens and food banks. You can even like for me, I in church, like I volunteer to do like worship or yeah, that kind of thing. And then teaching wise, like I was quite limited, but I did like Sunday school teaching. So like it can be anything, and as long as like you know what you're interested in and you try to get involved lah, and show that you are using your skills for something good. I think those are things that make your CV look good lah.
Okay, cool. Thank you. Anyone else to add? If not, I can move on to the next question.
Yeah, I just want to add on to Don's point. Like, I agree that I think the specific things don't really matter, but like it's because anyway, you guys are usually back over here for summer break, so might as well make use of the time. So like in second year, I actually did a research with A-Star, and then third year I did my elective. Then fourth year I actually helped out with the COVID situation expo. Like at the end of the day, I'm not sure whether all this does help with your PG application, but at least like when you're typing into your CV and stuff, there's some quality to it. Yeah.
Oh, sorry, can I just add also? So it's like about the soft skills that you gain. Like for me, I feel like through all these experiences, it helped me to shape like my idea of who I am as a professional. And you get to work with like people who are experts in their field. So you start to gain a maturity in the way you think and the way you carry yourself. So I feel like even when I was in the interview, I mean, it's just how you carry yourself. And when they bombard you with a lot of questions, like you know who you are, you don't feel like threatened or anything, you know, like you are confident, like, okay, I'm a professional, I can face anything. So I feel like these are things that shape you rather than like just checkpoints.
Cool. Thank you. Okay, I think we can move on to the next question, which is do you think your grades in preclinical or clinical use made you like a better candidate when you were applying for PEG?
Yeah, regarding that, I'm not entirely sure also, but I would say I did generally quite well for my uni years. So that might have played a part.
Okay. Does anyone have anything to add? I think if not, we can move on to the next question.
I think there is, if you see under the PG policy on the website, it actually says grades are one of the selection criteria. So, but I'm not sure how much whether it plays a part into getting the grant.
I've heard from my senior, don't let it stress you, but like they send like a form to your uni to ask them to like report on your grades and like your performance. And there's this like tick box area that asks like, oh, is it top 10%, top 30%, or top 50%? Yeah, but don't let that freak you out lah, because like I know people who don't necessarily score like top 10% or whatever. And there are also people who do lah. So yeah, I don't think that's all that counts.
Okay, we actually do have like a follow-up question. So I think one of the participants asked if it matters where you intern. So it's like, does it matter whether I intern in Singapore or intern in the UK? And if so, like, does it look better, for example, if I intern in Singapore for the PEG?
I mean, it's dependent on circumstance, right? Not everybody can get internship in Singapore. Maybe you're staying in UK during COVID. Like, I don't think they will fault you based on where you do it lah. But if you do it in Singapore, then you can just like expand on it lor. Say that like from your internship, maybe you can get an attachment somewhere. Yeah, but it doesn't really matter.
Sorry, can I add? I think it's about showing interest, and like I think like Dawn said, showing that you want to improve yourself. So I think in the UK you often have a lot more research opportunities, I find, because it's just a bigger country. It's relatively easy to get research audits, quality improvement projects, or whatever, just by being on the board. You can just ask around, and then by doing that, you will show you're interested in doing more than just the basic doctor stuff. And if you're able to do it in Singapore, it also shows that you're interested in knowing more about the way the Singapore system works. So I think that there's benefit in both.
Okay, cool. Thank you, everyone. I think we can move on to our next big question, which is basically to outline the structure of like your PEG interview. So I think this applies to everyone, but I guess I'll just ask Sean to go first.
Yeah, okay. So my interview slot was 20 minutes long, and there was a total of 3 people interviewed. So one of them was the admin officer, the other one was the interviewer. I can't remember what was his qualification. I think maybe a reg. And then the third one was like another doctor probably sitting in. So only the reg, I think, that asked me the questions. So essentially, if you're talking about it, like there's 3 people, but only one person is the interviewer. And so they did kick off the question by asking me like, okay, how was the COVID work that I did in Singapore? So that was quite short. And afterwards, they immediately go on straight to the case presentation. So that whole case presentation took up the whole 20 minutes. And after you present your case, all the questions were related just towards the case. And I understand that if I'm not wrong, usually they'll cluster your interview time slot along with your other school members, because like in total there were 4 of us that applied for Belfast, and we were all one after the other in terms of time slots. Yeah, and I can go on to like the tips, or Daniel, do you want to carry on?
Yeah, sure. Yeah, go ahead.
Okay, yeah. So for myself, actually, what I did was that I prepared like a simple and common topic. So I prepared one medical case, which was on COPD, and one surgical case, which was acute appendicitis. The one I used was the appendicitis one. So I think, remember that like common things are common, which is what actually all your doctors also tell you in medical school. So make sure you prepare something common and know everything about that particular topic that you are going to present. If let's say I heard that like you prepare something rare, they might actually give you their own case. Or if your case is actually short, they might also give you a second case as well. So I did take a lot of time. Like my entire structure of my case was the history, the examination, investigation, and the management plan. So I think that total I did drag on for about like 8 to 10 minutes. And that means also they will have a shortened time frame to ask me questions. Yeah, and besides that, I also prepared for like anatomy, etiology, risk factors, differentials, and complications regarding that particular case that I was presenting. So like try to memorize it by heart. I mean, okay, to be fair, I think you can actually use a screen and like read through because it's over screen, but like, I mean, it might not flow as well. So just say it a few times before the day before your presentation. And yeah, and if you have actually done any like clinical reports over like your clinical years, just keep them, because you might actually want to refer them in future when you do the PG interview, because I feel it's slightly easier than like thinking or like remembering an obscure case that you did like many months ago. I think that's very hard.
Okay, cool. Thank you, Sean. Maybe Dawn, would you like to go next? Maybe just kind of detail like maybe the questions or like just your interview process.
Sure. So I was quite shocked that Sean's was like 20 minutes plus, because mine was literally like 11 minutes. And I was like, oh, that's it. They didn't ask me anything like casual or like as soon as I started, they were like, oh, do you do a rotation? And then they were like, okay, present a case. Yeah, so I presented a case that was also quite like common. So I did on AKI, and okay, so like it was kind of common, but also has like a more detailed part to it. So it's AKI with rhabdomyolysis. So like I thought it would be a good chance to show that like, okay, I know the common stuff, but also like I did think about like something that is more specific. And then like, because I heard that in previous years they like to ask about electrolytes. So like I thought that would be like a hook for them. Then I can like show that I know something. So like I guess is you want to pick a topic or case that is also playing to your strengths, or something that you're interested to read more about, and then you can learn about it while preparing for the interview. And then questions wise, I found that like they asked, so I had 3 people also, it was similar, but 2 of the interviewers were asking me questions. So like initially the questions were quite related to the case, but then following that it was just quite random. Like they asked me like, what's the most likely pathogen for pneumonia? And then I was like quite stunned. And then I just had to give them the bacteria name, which was like quite weird. I didn't expect that. So yeah, I guess like it's very important to prepare for your case, but also like read widely lah. And then personally, like how I like rehearse my case is that like I will approach people on the ward that I was placed in, and then I'll ask them like, oh, do you want to grill a medical student? So then you get to like practice presenting your case, but you also get a sense of what kind of questions will come. So yeah, that's my case.
Cool, thank you. Denise, would you like to go next?
Yeah, sure. I think I had quite a different experience from Sean and Dawn. My interview lasted around half an hour or so, and there were also 3 people. So one of the doctors actually presented a neuro case and asked me how would I approach the patient, how would I manage the patient, and follow-up questions afterwards. And then the second doctor went on to ask me to present my case that I prepared in an S-bar format, and he asked me follow-up questions also. During the interview, there was quite a lot of teaching, I would say. So it's kind of like a teacher-student kind of interview. It's not like just grilling you on questions. So they were quite nice. So I think some of the tips Dawn and Sean has already mentioned, but I would like to just emphasize on the approach to the patient case. So one of the books that I used that I found that was quite useful was Dr. Nigel Fong's How to Approach like, Algorithms in Differential Diagnosis. So that was a book that helped me to formulate differential diagnosis, how to approach common clinical scenarios, how to investigate and how to manage the case. Also, like what I said earlier, it's also important to make sure you come up with a list of common core conditions in each of the modules. Make sure you know the etiologies, the risk factors, investigations, management for each of the core topics. It's also quite important to choose a case where the interviewers are interested enough to ask you follow-up questions. So for me, I presented a case on heart failure, pneumonia, and chronic pulmonary hypertension. So they asked me follow-up questions related to that. And I know that in previous years, they actually asked the applicants how to interpret ECGs, ABGs, and chest x-rays. But for mine, they didn't ask anything about that. So it's probably worth to go through some of those. So some of the websites that are good for those is like Life in the Fast Lane or Radiopedia. There's quite a lot of imaging practices that you can go on to practice for.
Cool, thank you. Maybe Elizabeth, although your interview was quite a while back, but maybe you would just like to share?
Sure. So for me, my interview was in person because I guess COVID hadn't happened yet, and it was about 4 years ago. But at that point, they didn't have the case presentations, so they would just bombard you with questions as well. I also had 3 people. I think they asked me one question on my CV and like how I would improve this quality improvement project that I worked on or something that I was not prepared for. But anyways, and then I think they gave me 2 ECGs, one with AF and then one with an end STEMI that I actually said was a posterior STEMI and then corrected myself later. And I think, and then with each one, they asked me a bit about the management and then moved on. And then they also, I think for me, all 3 of my interviewers took turns asking questions. So they kind of just presented me with lots of random questions. Like they randomly asked about the anatomy of the thyroid, which I also did a lot of studying for like the emergencies and basic systems, but I had to dig out my year 2 knowledge about like anatomy and like what structures run near it, the blood supply and so on and like that. So, and then they asked me about like risk of surgery in like a thyroidectomy and things like that. I don't know, it was a bit random, but I think what they were really trying to see is the way you think and your approach. So I think what Dawn said is a good idea because I think by asking people to quiz you, you can get an idea of kind of like the questions that may follow on, which could be anything from basic pathophysiology to NICS management, differentials and so on. I know my friend got a bunch of endo results as well as an ABG to interpret as well. So they may ask you to interpret those.
Yeah, thank you. So maybe I'll just ask like a few small follow-up questions about the interview. So I guess maybe like how detailed like should the case be in terms of like, yeah, essentially that, yeah. Sean, would you like
Yeah,
to
oh
go?
yeah. Okay. Like I mentioned, mine was actually pretty detailed, so that's why it took out quite a few minutes. I think, in essence, just try to prepare as much as possible, because they would like to ask anything regarding a case. Like my appendicitis case, they also did ask about like the different anatomical positions of the appendix. So I actually had to like list it, like, I mean, thankfully I actually did study it, but you actually have to like list all of it. And they like to ask also like year 1, year 2 stuff. So don't forget about your anatomy or like biochemistry. Like I heard from and microbiology as well. So like, I heard from one of my friends, like he got asked about like very specific antibiotic stuff, like which antibiotics like targets like gram positive, gram negative, which is a broad spectrum antibiotic. And they did even ask like what is the common name for metronidazole for him. So actually, if you don't work in Singapore, you wouldn't know it's flagyl. Like I didn't know until he told me he didn't know and he Googled it. But apparently they would ask that. So then again, it also varies from your interviewers. So some interviewers are actually nice. Some can be very condescending. So it's really hit or miss regarding which interviewer you get.
Mm. Would anyone like to add? If not, I can move on. Oh, sorry. We actually have like a follow-up question, which is sorry, it's a preclinical student actually asked what a case report is. So I guess maybe if someone could just kind of explain what a case report is.
It's just like telling the story of this case, but in a systematic way lah. Like in clinicals, like you will like witness a lot of handovers, and you see how snappy it can be, but you can also see how detailed it can be when it needs to be. So you will get a sense of like what it should be like by going for handovers, for tagging along with doctors, or you can read like case reports online. You can just search up case reports on a topic you're interested in and just see how people describe law. Yeah, and then just like quickly, like answering that question earlier, like how detailed. I think you just prepare a lot and then expect to be cut off if it's too much. Then like, yeah lah, if they want to cut you off, then it's their loss but you don't lose out.
Okay, cool. I'll move on to the next question. So for those who are applying after their not international, their intercalated year, will the interviewers take into account the fact that they haven't had much clinical experience? And also, would you advise against applying after the intercalated year? So maybe Dawn, could you like answer this question?
Yeah. I would just say that I didn't do iBSc and I actually don't really know anybody who got the PG after the iBSc year. But that said, like I feel like it's always worth applying because even if you don't really have much clinical experience, at least through going through the interview one time, you know what it's like, and then that will eliminate a lot of the anxiety when you're applying again next year if you don't get it. But there's always a chance lah. But I guess whether they will know that you've done it, there like they will ask you, have you done a rotation at the start? And then you can explain to them, yeah, I just did my iBSc. Yeah, but I guess like Dan explained earlier, the reason why they always do it in clinical years is because they want to assess your clinical acumen lah. It's not just about memorizing things in the textbook. So it doesn't set you up well if you haven't done a clinical year yet. But that's it, I think it's worth it to apply.
Okay, cool. Would anyone like to add? If not, I'll move on to the next question. Okay, cool. So to your knowledge, I guess like how has like the nature of the interview changed over the years? And I guess like through the conversation, we've also realized that obviously now it seems like there is less like I guess of the of like the data analysis in terms of like the ECG and X-rays. So I guess maybe Dawn, could you kind of just talk a bit about that?
Actually, Elizabeth, do you want to share about your experience from a few years ago and then we can follow up?
Sure. I think the main difference is the fact that there isn't a case presentation. I'm sorry, there didn't used to be a case presentation, and now there is. But I think at the end of the day, it's a clinical interview. So if you haven't had clinical experience, aka if you're in a 6-year program and did a BSc and you're applying for the interview, like I said, I know people who applied and didn't get it, even if they were in very good universities. Not to say that I think all universities are good, but yeah, I think it is a clinical interview at the end of the day. If you're unable to answer clinical questions, then it may be a bit more difficult to get it. Yeah.
Okay. Growing up, I watched a few of like the previous years PEG talks. Yeah, so like I get the sense that many years in the past, it used to be quite casual because it was just the beginning of giving out the grants lah. So they were quite, generous, and they were just giving it. And so it was just sort of like a formality. And then it developed into like, okay, asking them some questions to assess their ability to think on the spot. And then as the years went by, I guess the standards went a bit higher, and then maybe I don't know what's the reason lah, but they start to ask more trickier questions, some high level questions that like really make you flustered and then stress you on the spot. And then they also started asking you to present a case. And then they started asking for giving you interpretation questions like ECGs, ABGs. For our year, because it was over Zoom, I think it's because it's over Zoom lah. I don't know what's the real reason, but we didn't have interpretation questions, and I'm not sure if that's going to be the case next year as well.
Okay, cool. So I think I'll move on to the final question. Sorry.
Yeah, actually, I think one of my senior had a ECG, but then they like shared it over Zoom. So, so just be prepared for anything.
Cool. Okay, that's good to know. So I guess we'll just have like a final question regarding like PEG interviews. I know you already mentioned a lot of like preparation tips, but I guess are there like any final words that you just like to say for those who are going to apply for the upcoming like PEG window? Maybe Sean, you'd like to just start, and then I'll open it up to the rest.
Right. So like it's very important to practice your case as what Dawn has said previously. Like for me, I didn't practice it with like a doctor, but I did practice it with my friend lah. So actually, like the day before, like my friend did ask 2 questions, which strangely enough, like the interviewer also did ask. So that I was quite lucky regarding that. And I think they really want to test your thinking ability. So it's normal for you to not get all the questions right, and don't stress yourself over it. But they just want to test your how you actually process and analyze things in general. Yeah. So if you prepare sufficiently, I would say you can get at least 80% of questions right, and that will put you in a rather good spot. And also, I want to add that they actually didn't tell us that we needed to prepare a case report, but somehow like everyone was saying that usually that's the format of the PEG interview. So that's why I did prepare the case report. Yeah, in fact, inside the interview, they only give us like your time slot, your date, that's all.
Okay. Would anyone else like to, I guess, give final tips for those who are doing the interview?
I think I just want to add, like, even if you can't answer the question, just try to verbalize your entire thought process, because they would then try to guide you towards the correct answer based on what you say. So they're actually trying to help you during the interview.
Would anyone else like to go? If not,
maybe frame your mind before you go in. Expect the worst lah. Expect them to be very mean, and then if they're nice, it's good lah. And then expect to not know the answers. Expect to be very pressurized and very put on the spot. And then if you're able to try and put yourself in that situation, so that you know how to react to it. Your body's not shocked.
Nice. Elizabeth, anything to add? If not, we can move on.
I think I agree that the most important thing is to show your train of thought. So you need to show the way you think. So even if you don't arrive at the answer, because if if you're not being able to arrive at the answer, they may just be trying to push you because it means you're answering well so far. So they just want to see how you think and whether you have like a clinician mind, whether you're going to add value as a doctor in Singapore, if that makes sense. Because sometimes you don't always have to answer straight away in general, or you may not know, but if you're able to show that you're able to think in like a useful way, I think that's more important. So yeah, so basically kind of like thinking your thought process out loud, thinking about what you're considering, structuring your answer into like, I mean, however, yeah. Even for example, the bacterial question, I think Dawn mentioned earlier, the common bacteria for pneumonia. You could possibly say, oh, well, it depends on whether it's like community or hospital acquired or whether they're immunocompromised. Even that kind of structure, they can immediately say, oh, she knows roughly what's going on. And then you can say most common for this is for CAP versus HIV versus immunocompromised and so on, for example. Yeah.
Cool, thank you. We actually do have a follow-up question, which was approximately how long did you take to prepare for the interview? So I guess maybe Sean, you all can just say.
I think I prepared like 2 days before actually. Two days or a day before, because like if you already have case reports before that, then you can actually use it and then just frame up the exact thing that you want to present. So yeah, so I didn't think I'd take very long, but I mean I would say that if with sufficient preparation beforehand and like you are usually quite studious and you keep up to date with your medical studies, you should be fine. Yeah, especially if you're already in the clinical years.
Cool. Dawn, maybe you want to go next.
Case-wise, I knew the case I wanted to use around like a few months before. So I wrote it down and then I did like my reading around. And like Sean said, like you need to keep up to date with like your studies lah. So like I feel like people will hate me for saying this, but like I think you have to start like from the beginning. You need to get your foundations right lah, and then you just need to keep studying. But I mean that's just so that it prepares you well for being a doctor also. So it doesn't hurt to study lah. And then yeah, because I have that case, I wrote up that case months before, and then like whenever I felt like it, I would go back to read a little part of it again, so it doesn't feel like too heavy. And then it was only like during the last 2 weeks before that I started like practicing or like thinking about like questions.
Okay, maybe Denise, you want to go next? Or
Sure. So for me, I think I prepared a case back in year 4, so 1 year before, but I always kept a lookout for like more interesting cases during my rotations. So in the lead up to the interview, I tried to come up with a list of common clinical conditions and the etiologies, risk factors, investigations, and management plan for the core topics like cardio, GI, neuro, respi, all that stuff. And a week before, I actually look over the case report again and make sure that I can memorize it and present it to my friend, and also do some reading around the case as well.
Okay. I understand Elizabeth didn't really have like a case report, I guess, during the interview. So if you have nothing to add, then I guess we can move on. Okay, cool. Okay, thanks. So we're actually going to ask like now a different, so moving away from the interviews. So for a successful recipient of the PAG, is it possible to delay the beginning of the Houseman year in Singapore? And also what are some reasons for doing so? And I will ask Elizabeth.
Yeah, so I came back to do my F1 here. So I came back straight after med school, but you can do your F1 overseas. You can do your HO year overseas. The main benefit of this is that it allows you to get GMC registration. So if you want to go back and work in the UK for whatever reason, you have that door open. So I have friends who are doing that at the moment. Now, usually after 1 year, you do have to come back to do your first year as an MO in the Singapore system. However, if you have any special circumstances that you wish to delay that for whatever reason, I believe they can consider on a case-to-case basis as well. For example, if you are very, very involved in research, overseas. But then this would be, again, like I said, it would have to be, you would have to kind of appeal for this situation.
Would anyone else like to, I guess, add on? If not, we do have like a follow-up question. Yeah. So actually, so what are the considerations between getting PEG and staying in the UK to get the GMC registration?
So I think I considered this a long time, because I think it depends on what you want to do with your life. So yeah, I think you're forced to think quite early on what, like, when you apply for the PEG as well, what do you want to do? Because come back to Singapore, or do you want to go overseas? Because once you essentially start training, you can't switch training. So if you're halfway through training as a surgeon, you cannot jump ship and then go from the UK system to Singapore. So in that case, for me, I was thinking, if I'm set on training in Singapore, then there's no point for me to get my GMC registration, because I'm not planning to practice in the UK at this point. Because once you get into training, I'm not gonna stop my training and then go overseas and then restart it all over again for another 8 years, right? So for me, that I mean, that's why I decided to come back as an HO or as an F1. But for other people, for example, if they have boyfriends or girlfriends in the UK, or if they're worried about not being able to get into training in Singapore after completing your bond. So, for example, you've worked as an HO for 1 year, which is your first year of the bond, and then you've worked as a MO, which or F2 for 3 years, and you keep on applying for residency and you can't get in. And then, if in that situation you really want to get into residency and you're just a bit fed up, then maybe you may want to consider moving back to the UK. But also in that case, I would say very much you have to consider other things in life besides work. So do you really want to work in the UK for the next 10 years? If you have any, like, let's say any partners or any family in the UK to kind of keep you there. And also, it doesn't mean that you can come back to work in Singapore as a consultant either. So it may be difficult to get a consultant job in Singapore after training and completing your training in the UK, especially if you're working in the public healthcare sector. Unless you are some incredible top like consultant that everyone wants. But so I think that because Singapore has a lot of doctors and it's very top heavy, there are a lot of consultants, and as it is, it's kind of it's kind of like filtered down. So there are lots of big bosses, so there are a lot of consultants, and that means it's difficult for people who are completing training to then become consultants, because then there may not be enough jobs. And that has filtered down into making it very difficult to get into residency. Whereas in the UK in general, it's easier to get into residency because there are enough spots. So yeah, I think it very much depends on, you have to think about what you want in life, about where you want to be for the next 10 years. If you're very set on staying in Singapore, then there may be some utility in just coming straight back to Singapore earlier. And forfeiting your GMC if you're not planning to practice there in any way. But if you're worried about possibly not getting to residency and you really want to just kind of to finish your training, and you would consider going back to the UK, then maybe you want to do your F1 in the UK.
Okay, thank you so much. So actually we have 2 follow-up questions, so I guess we'll just go through them one by one. So one of the participants asked if they were to do FY1 in the UK, would they be able to come back to Singapore being a HO or an MO?
So you come back as an MO. You come back as an F2, as a medical officer. There are pros and cons to that as well. So coming back as a first-year doctor, usually you have a little bit more leeway. So they're a little bit more understanding. The expectations are lower in general. And you say that you're overseas grads, and then the expectations are even lower because you don't know the system. So in general, that it may be easier to come back as a HO. But then again, HO year is quite difficult. I'm not going to lie, it's very long hours. So I mean, I think it's up to you. Yeah, I think MO, you have more responsibility, but then that working hours may be slightly better
Okay. So we actually have like a second follow-up question. So if you get the PEG, is it like a complete necessity that you need to be back in Singapore right after graduating? Or essentially, can you tell them that you'll come back like after being a consultant? Or I guess, yeah.
No. So you are allowed to delay coming back for 1 year, like I said. So you can come back as a first year doctor or as a second year doctor, F1 or F2. If you have special circumstances, you can appeal, but I think you can maybe delay for 1 year kind of thing. You cannot delay until consultant. I mean, that defeats the purpose of trying to get junior doctors back to Singapore, which is essentially what the PEG was.
Okay, cool. Is there anything else that anyone wants to add? I guess just regarding like delaying coming back to Singapore. If not, we can move on to like another question. Okay, no? Okay, cool. So next question. So are applicants' choices for hospital allocations considered, or are they just random when you come back to Singapore?
So they're random and across the board, whether it's PEG or non-PEG or local or overseas. They can't just assign you hospitals. Yeah, you indicate your preference, but and which I think they try to take into account, but it's random. It doesn't matter what your grades are or where you come from.
Okay. So we do have a follow-up for this. So what are the chances of getting into teaching hospitals in Singapore if you get the PEG? Is it higher than trying to get into those hospitals without PEG? Yeah.
The PEG makes no difference when you start working. What it essentially does is it kind of guarantees you to get a job in Singapore, so you don't have to apply for a job when you're in your final year. So you have done kind of like your job interview a lot earlier. Yeah, so it doesn't make any difference on the ground. You're treated exactly the same as everyone else. No one knows that you have it. Yeah.
Okay. Is there anything else that anyone like to add? If not, we can move on to another question. Okay, cool. So do you think that as a successful PEG holder that you have a better chance of, for example, getting postgraduate training or residency in Singapore? And Denise, would you like to answer the question?
I think like what Elizabeth says, there's no difference whether you get the PEG or not, because no one really knows whether you have it. So I've talked to some senior doctors working in Singapore. They said that everyone is treated the same regardless of whether you're a holder or not. And getting into residency really depends more on your work performance on the ground, and getting past the residency interviews as well.
Does anyone want to like follow up with that, or? Okay, cool. So we can move on to the next question. So how many houseman intakes are there in a year? And as like a returning UK PEG grant holder, you get like a choice of intake.
So in terms of intake, there are a few intakes overall. So there is kind of like in general, like when all the UK grads start, the Australian grads, the Duke NUS, and then the NUS ones. And they all start at different times. So when you're working, you realize that everyone is on a slightly different timeline than you are, even in the same year. So in my year, I came back last year. It was a bit different because of COVID. So we were given the option to start earlier, or we could start at our original kind of, because a lot of people graduated earlier, we could either start earlier or we could start at our original time. So that was the overall option. I think in general, if you're coming back from the UK, everyone starts at the same time, which it is, I think, around September this year.
Okay. Does anyone like to add anything? If not, I guess now we can move on to a new section where we'll talk more about the PEG contract terms. So are there any pros and cons that you can see when looking at like the contract terms?
So I don't think the contract has changed very much. Essentially, they're bonding you because they want you to come back to work as a junior doctor. And then, so I think the main pro is that it guarantees you a job. In addition to money, it guarantees you a job. So you don't have to worry about trying to apply for jobs in Singapore in your final year. I know some people, sometimes they do not give you the PEG money, but they may offer you a job in the interview instead, especially if you're in your final year. I mean, so I guess it functions as a job interviewer. So I think that's a major pro. In terms of cons of the contract, there aren't too many. It's actually quite a straightforward contract, and most of it is to do with the money they give you. Yeah, you get a one-way return ticket on your way back. You get I think about $800 to ship your stuff back, and you get return flights for your elective to Singapore and back to the UK if you want. In addition to the 150,000 money they give you. In terms of cons, I think the main one is that you have to pass. So you have to pass every year. You cannot fail any of your years. Otherwise, I think it's void. And if you choose to break the PEG bond, then there is a penalty of 10% of however much you have claimed from them. And in addition to paying back, the money you took. Yeah.
The 10% is per year, so it adds up.
Yeah, so every year. So if you take 150, you would have to 150,000. You have to pay 165,000 back to them, which is a lot of money.
Cool. Okay, so actually we do have a follow-up question regarding like the PEG. So without the PEG, how difficult is it to get a job in Singapore? I guess in terms of like the healthcare scene.
I don't think it's that difficult. I don't really know. But you do have a lot of people who come back and work. So I think at some point, I don't actually know how you apply for jobs in Singapore. I'm sorry, but yeah, I don't think it's too difficult if you can't get the PEG. Otherwise, if you sit for the interview, like I said, they can offer you the job and not the money if they wanted to.
Would anyone like to add, I guess? Okay. If not, I guess like we'll move on to like another kind of question, which is, I guess, are there any circumstances in which you may consider breaking the bond and I guess suffering the penalty? Elizabeth, would you like to go?
Yeah, so the penalty is 10%, unless they've changed it, but I don't think they've changed it. In terms of like why you would break the PEG, so if you're working for about 3-4 years in Singapore, that's not very long actually, because by the time you finish your first year, and let's say you start to apply for residency or whatever, then I think 3-4 years can pass very quickly in the public healthcare sector. In terms of why you want to break it, I'm assuming it will most likely be for personal reasons. For example, if you really like die must go back to the UK for whatever reason, if your fiance is there or something, then maybe. But otherwise, either that or you just like absolutely cannot deal with the Singapore healthcare system, which is again I think why they like to see that you have had at least a bit of experience working in Singapore, because then they can see that you have at least a little bit of an idea of the expectations of what the healthcare system is like.
Okay, thank you. If there's nothing else from the rest, I'll actually ask this question, which is basically, if you were successful on the subsequent application, would you outline the steps in which you took to improve your profile? But I do understand that none of our panelists today basically applied for a second time. Is that correct? Yeah. So I'll just like to kind of just share my screen again. And so this is based off essentially last year's panelists, and some of them did do like the second application. And I think in terms of the points that they mentioned, they did say that the interview was like probably the most important reason why they didn't get the PEG. So for example, like a lack of exposure to clinical studies, or like basically just not knowing how to like interpret the data, or like kind of showcase their case study like good, was the reason why like they couldn't really answer a lot of the questions. Possibly like they couldn't really explain their thought process. So I think like in terms of that, like applicants, when they redid the interview, they were probably more aware of like how the interview was structured, or they were probably more just aware of like clinical studies, because for example, sometimes these applicants were like intercalated students and had like little to no exposure to like clinical studies. And I think also like in terms of CV building, as was previously said, like it wasn't as important when compared to the interview. So I think in terms of like second applications, it's really just like working on clinical studies, on the cases, and I guess on just presenting them like well to the interviewers. Yeah. Okay. So I will then move on to I guess one of like the last questions that we have. So what are some things that you just share with anyone who's still on the fence in terms of like whether they should accept the PEG? And we can start with Elizabeth.
So I think the main thing is, again, kind of it's not really work related. It's probably about you yourself and where you want to work, versus like the actual job. So like, yeah, do you want to work in Singapore or the UK? I think that's essentially the simplest question. And also for the next like at least 5 to 10 years, like, is that where you want to be? So I think the reality is that as an F1 in the UK, whilst it's very different from your experience as a medical student, because you have a very close community, you have lots of friends, you can go and do things together. But once you start work, you are very much, everyone moves out to different deaneries and works in their own hospitals. So what you end up having are essentially work colleagues, as well as friends who are all over the country whom you cannot see so regularly usually. So if you don't have family there, if you don't have a partner there, then you may end up kind of going home to your own rented flat every day. Yeah, sorry, I'm a bit biased because I came back as well. But I think that for me, that was a big consideration. Essentially, I want to come back to my family in Singapore. That was it. So, and I don't want to work in the UK for the next 10 years because I want to come back to Singapore. So that was for me was the biggest consideration for why I came back, also in my first year and not waiting for my GMC. But I did consider it for a very long time.
Yeah. So actually there's like kind of a follow-up asking why you chose Singapore over the UK. But I guess you kind of answered it, mostly about like family and stuff. Yeah. Okay, cool. I think we have a final question. But I think it's mostly been answered. But I guess just to summarize, in terms of like this like segment of the talk, which was what are some pros and cons that kind of influence your decision to complete housemanship in the in Singapore over the UK, or rather if you were, in the instance where you did it in the UK instead.
I think the main thing is the GMC registration. If you want to consider working in the UK, then I would strongly recommend you get your GMC registration. If you're worried about getting to residency, or you think that you may want to work at any point, then I would recommend you can maybe stay in the UK. If you're really dead set to just come back to Singapore and just stay here for sure, and you're willing to try up to like a few times to get into residency, then because basically once you get into residency, then you're stuck in the system, right? You're going to be here for 7 years, and then you're going to hopefully come out as a consultant. So the thing is, like, how long will you take to get into residency? And if you cannot get in, will you be willing to go back to the UK to do it there instead? So for me, I decided that I was willing to try multiple times, if required, to get into residency in Singapore, because I just wanted to stay here and train here versus in the UK. Therefore, I didn't really need GMC.
Okay.
I just want to share another perspective to that. So I feel that like it's quite a blessing to have the chance to work in a different country, and a lot of people actually are fighting for that chance. So like for me, I think it'll be a really good experience. Like whether I have the grant or not, like we'll still most likely be very welcome to apply back to Singapore as an MO, provided you're not in residency or something lah. Yeah, so I think you have like your whole life ahead of you to work in Singapore. So I personally feel like taking a year to stay in the UK, despite like the advantages of having a year as a houseman in Singapore to learn the ropes. Like I feel like, okay, when I come back as an MO, it might be quite difficult to begin with, but it's always going to be difficult whenever you change jobs, when you change like your living location. So I feel like the experience is worth it lah. But that's my perspective.
Okay, thank you. Is there anything else that anyone would like to add?
Sorry, can I just add quickly? Sorry. I completely agree. Like, I have a lot of friends who stayed to do Actually, I'm the only one from my uni who came back to do F1 in Singapore. Everyone else stayed because I think essentially working life in the UK is a lot better. They value work-life balance a lot more. In Singapore, you work 6-day weeks, 80 hours a week expected work time. In the UK, they have like a 48-hour cap or something, and you get your weekends and you get your time off and stuff like that. So I think if you want to work overseas and get that experience, especially if you have like friends or things you want to do, I would really, really recommend that you consider it strongly. One thing to mention though is that if you come back as a houseman in Singapore, you can apply for residency in your houseman year. If you're able to finish your houseman year before the residency intake starts, you can apply. So I actually applied in my first year as a houseman essentially. So you can, in a sense, then that may be an advantage, or at least you can kind of like get to know some people who can write you your reference letters and so on as well, or you can become a bit more known to the people who are choosing residency people. But again, if you're not kind of like gunning for residency straight away and you're okay to kind of like work at an extra year, learn the ropes, then there's no rush to come back.
Sean, did you want to add something just now?
Yeah, I want to add that at the end of the day, signing a PG is also quite a big decision. So make sure you think about it carefully, like all the aspects, not just about like the job itself, but like with your family and friends, and like where you actually want to settle down in the long term. Because if you come back earlier, it does give you a slight advantage versus like, I mean like, because you get to know the system and everything. But if you want to stay in UK to do your residency, that means that you need to think carefully that in the next 10 years you'll be stuck there and you won't be back home. So you really have to think about all this aspect. It's different when like you're a student, maybe you're a student, you have a longer summer break, but when you're working in the UK, your breaks might not be as long as well.
Okay, cool. Thank you so much, everyone. Yeah, I think I will end the seminar session now, and we can also now move on to our Q&A segment. So if everyone already doesn't know, we're gonna use Slido for this segment. Yeah, so here's the QR link, the QR code. May I just leave it here for 30 seconds for everyone to just to like kind of ask any questions regarding the PEG, or if you just want to ask like specific questions for any of our speakers, feel free to just do it on the Slido link now. Yeah, just wait about 10 seconds for everyone to just rest a bit. Which is again about electives. So you can only get electives in Singapore during summer you can only get electives in Singapore during summer when you are end of year 3. So would that be disadvantageous to anyone if he doesn't do electives? Okay, wait, I'm so sorry. I think okay, I think they're just basically asking like whether or not like it would be disadvantageous to someone if he didn't do an elective, because you can only do it, I guess, after like clinical school starts. Yeah, so in terms of like maybe whether or not you should do electives like in your preclinical years, for example.
I think you should definitely do electives in your preclinical year. It doesn't have to be the official university related elective. Mine got cancelled. Mine's meant to be at the end of final year and got cancelled because of COVID. But you can always do like the rest have said, work experience or research in your summer, even from pre-medical school. So for me, I always did something during like every single summer from year 1 onwards. It doesn't have to be the official elective.
Yeah, I think usually the PG interview is after the first year of your elective. I'm not sure if that's right, because that's the case for us. So after your 3rd year, you should be able to apply for, like, if you're back over, for the holidays, you are able to apply for elective back in Singapore. Or if you're staying in UK, you also can do an elective back there. Yeah, and in your preclinical years, you may not, I mean, if you follow the procedure, you may not get elective, but I think you can do like research projects. So I actually did one with A-star during my second year summer break.
I didn't
Yeah.
have an electives, like a formal elective slot before my interview, but like literally anything can be an elective, even like those contract jobs. Like before uni, I did a contract job in Tan Tock Seng, and that was just like a PSA, but you get to stand in clinic and watch everything happen. So like literally anything can be an elective. Yeah, doesn't have to be formal.
I think ultimately they just want to show they just want to see your commitment towards getting to know the healthcare system in Singapore. So not just an elective, just doing volunteer work is fine as well.
Okay, thank you everyone. So this regarding the interviews. So do they ask you for any case report in the interview, or do they ask for a case report in like a particular specialty, for example?
For mine, they started off like saying, okay, you're already in your second year of your clinical years. So like, are there any interesting cases that you've seen so far? Then they just ask you to describe about it. So yeah, they didn't really narrow down the particular specialty that I had to present in. But I would say for preparation wise, make sure that your foundation in internal med and general surgery is at least strong.
Okay. What does anyone else want to add? If not, I can move on.
They asked me what rotation I just did, and then they said, from your rotation, is there any case?
Oh, okay. Cool. All right. So I guess we can move on to the next question. So again, regarding the interview, have any of you had experience with anatomy questions being asked? And for example, like identifying features on a particular X-ray, for example.
Yeah, so for my appendicitis case, they did actually ask about the different anatomical locations of your appendix and which ones are the most common.
X-ray, we didn't have the question lah, but I suppose when you're interpreting an X-ray, you naturally go systematically and you identify the features. So that's given.
Yeah, I think I mentioned earlier, I got asked about the anatomy of the thyroid gland, blood supply, nerve supply, like, you know, like the recurrent laryngeal, that kind of thing, side effects. Yeah, and I got asked about the anatomy of the heart because I said I was interested in cardio, which I was not prepared for. So I would prepare. If I had to do it again, I would prepare better.
Guess you gotta be careful with what you say. All right. Okay, if there's nothing else, I'll ask the next question. Oh, I think this question has been asked, but they asked whether do they put you into hospitals of your choice or are you assigned? So I think they did. It was asked, and that it was a random allocation, correct? Okay, cool. All right. Okay, so I think again going this is another question. So regarding the CV, so how did you guys like structure your CV? I guess this person kind of wants to know like what kind of pointers you added, or like, I guess what kind of experiences you added to the CV. Sean, maybe you want to go, or
Yeah, sure. So this year, I'm not sure whether it's the same for previous years, but this year we actually used the Bright Sparks portal, and it was quite clear what they actually wanted. So you didn't necessarily attach your usual CV, but you kind of need to type over your CV to the Bright Sparks portal. So I did include like my academics, because I actually did quite well in my first couple of years, and then like I indicated my few attachments over a few years, as well as like extracurricular activities. Like I was involved with SMS UK before, and other like CCAs that I've done as well. And I think there was a short personal statement. I can't remember. Was it like 200 words? Yeah.
I had worked on my CV like earlier in the year, so I really wanted to like just put it up. So on the portal it allows you to upload files. So I just uploaded my CV, and then in the box where I think Sean would have wrote his CV, I just said refer to my CV below. Also, like there's a limited amount of space in the box, and my CV is very long-winded, so I just uploaded the whole file and hope for the best. Structure-wise, like I'm looking at mine now. So like I put my details, then qualifications, work experience, volunteering experience, leadership, research, audits, conferences attended. I don't think that's more like a professional one because I did it with my friend. But leadership, volunteering, work experience, research experience, I think those are the main things. Any awards from academic achievements, yeah, put it in.
I think for me, oh, you want to go ahead? For me, I did the same thing as Dawn, but I also included recommendation letters from the previous electives I've done.
I think for me, in terms of CV structure, I remember I attached my CV as well, and I think they actually looked at my the one I attached because I saw. I mean, it was physical, so I could see them flipping through the one I attached. Yeah, I think for me, I structured it with like like academic, like prizes, awards, and then I think it depends on what the strong points you want to bring out are. So for me, I'm keen on research, so I had my section on like publications, then conferences. Then like book chapters, audits, and quality improvement projects. And then I just shoved all my extracurriculars at the end. Like my SMS, it's very important, but like for me, I wanted to highlight more of my my research stuff. So I put that first. So I think it depends like how much you have as well to put in, yeah.
Okay, cool. Thanks everyone. So moving on to like final questions. So I think one person asked about like the technical stuff regarding like doing FY1 in the UK after taking the PEG. So I guess like maybe like more about the process of doing FY1, like I guess like so what's the like in terms of maybe timeline, like how the process is.
I'm so sorry, I blanked out. Can you repeat that?
No worries. So like I guess the question was one of the participants wanted to know like how the process of like going through FY1 like in terms of timeline maybe after taking the PEG. So does that mean like maybe FY1 then FY2 or yeah, I guess.
So I assume the question is saying that you want to do F1 in Singapore and then come back, right? So you can apply for your F1 and so I was on the fence like I mentioned earlier. So I actually applied for F1 and got a job in the UK and then like pulled out at the last minute to come back to Singapore. Because I wanted that option open for me until the end. Not saying that you should do that if you're sure you want to come back, but you can apply with the rest of your, like everyone else through the system, which involves doing like the SJT, and then you get your that ranking score that you can use to apply for deaneries. And then based on that, you can get into your deanery, and then you can like rank your hospitals and that kind of thing inside. So that's what the process is like. It doesn't affect whether you have a PEG or not because they don't know about it. So for me, I actually got my all the way down to my hospital allocations and which job I'll be starting in. And then I just emailed them to say that I was going back to Singapore. And then that was kind of it. I just pulled out of the system. Yeah.
Okay, cool. Thank you so much. I think I'll just have like one final question, which is that I guess people just want to know about like the estimates of the number of PG like applicants like a year. So I guess like if you guys maybe I don't know want to just give a number, but I think it's quite difficult.
I think for my school, like 2 out of 4 of us got it. But I mean that's a very small sample size, so I don't think necessarily it's like 50%. You know, I'm not sure the general population.
So 4 years ago now, it was 20%. I asked them directly how many of them got accepted, and she said about 20%. I think since then it got increasingly difficult. As I understand, the year after me, I think only about 3 or 4 in total were given out. However, because of COVID, I don't know if that has changed. It sounds like maybe they are more keen to bring doctors back now. But I do not know if this is true. I don't know if anyone else has a better idea.
I think the point on like them wanting to bring more doctors in is probably true because they also did not saying that you guys want to transfer, but like there also is a higher chance of you guys transferring now if you actually apply for a Yonglin transfer. They are actually taking in quite a lot after, I think after COVID. So yeah, so I think that this year PG might have increased. I don't think it's 20%. I would say it's probably a number slightly higher than that.
I know
Cool.
for the few years after me, they kept on it was always on the fence about whether the entire PEG program would actually be stopped. It continued, but it was always kind of mentioned, or we're like trying to cut down, we're trying to cut down. It may be stopped, it may not be stopped. But I think that's changed this year onwards.
Okay, cool. Thank you guys so much. I think we've run out of time, and I guess like that's also all the like important questions that have been like answered. Cool. So actually, Zen, you can stop recording. But I just want to thank again all the speakers just for like being here with us.